Hi, and welcome to today's show. I'm going to try to do something a little bit different, and I'm going to try to make a series out of it, and I'm going to call it Outbreak News Across the Globe. And about once a week, I'm going to go ahead and take a look at 6 of the 7 continents. Of course, I'm going to leave Antarctica off of it, and pick out one big outbreak news or infectious disease news story coming off of that continent and produce one of these news videos. I'm going to try to do it once a week. Okay, so starting alphabetically, let's start with Africa. And of course, I'm very, very tempted to do Ebola, but there's a lot of other things going on there, so that's what I'm going to try to do. Of course, I'm not going to neglect Ebola, but there's a lot of things going on, and one big thing is the malaria epidemic in Burundi, which is a small, landlocked country in Central Africa, and I believe it's right next to the Democratic Republic of the Congo. And so far, between the beginning of the year and the end of July, they saw over 5.7 million malaria cases. To put that in perspective, the country of Burundi has about 12 million people. So we're talking about half the population of the country. And this is a significant increase from last year. Though it was in the millions, it was millions of malaria cases, it was still quite a bit lower than what we're seeing year to date in 2019. In addition, the outbreak has seen over 1,800 fatalities from malaria. So that was the end of July when the latest figures came out. But at the time, the fatality numbers from the malaria outbreak in Burundi was essentially the same as the death toll caused by Ebola in the DRC. So that just tells you the massive impact of this outbreak in this small African country. Now, despite the outbreak reaching epidemic proportions, Burundi has not yet declared a national emergency. This delay coincides with the country's upcoming elections in 2020. Isn't that always the case, right? A senior government official said that the president, Pierre Nkurunziza, don't know if I said that right, fears that such a declaration would be seen as a failure of his health policy. So they're not declaring a national outbreak because of politics. Always a bad thing. Well, this outbreak in Burundi has been noticed by the Centers for Disease Control, and this week they put out a travel notice for Americans that plan on traveling to Burundi. And they're warning, because of the malaria epidemic, to take special precautions if you're traveling to that Central African country. And it says, what can travelers do to prevent malaria? Take prescription medicine to prevent malaria. There's chloroquine resistance pretty much most places in Burundi. So travelers should use daily atavacone proguanil, daily doxycycline, or weekly mefloquine to prevent malaria. And of course, because drugs that are used to prophylactically prevent malaria, they're not 100% effective, so travelers should also take all the necessary steps to prevent mosquito bites, which would include using repellent. If you're sleeping, if you're not in a building that's screened and properly air conditioned, you want to use an insecticide bed net. Very, very common preventive measures in malaria countries. Okay, next on the map, I'm going to Asia. Could look at Southeast Asia, right? Countries like the Philippines and Malaysia and Thailand and Vietnam. The more northern Asian countries like Japan and Korea, those are possibilities I could be looking at on a weekly basis. And of course, then there's South Asia, the Indian subcontinent, Sri Lanka, India, Bangladesh. And for the first episode, I'm going to look at Bangladesh because they have the most dramatic story, in my opinion. Now, the dengue fever outbreak in Bangladesh has been astronomical, and I'm not trying to be hyperbolic. Since the beginning of the year to yesterday, there's been over 61,000 dengue patients admitted to hospitals across the country, and the flow continues. And just yesterday, there was almost 1,500 cases admitted to hospitals. Well, what does that mean? There's countries that have a lot more dengue, but there's not a lot of countries that have seen more dengue in the past 2 months. And so there's been 61,000 cases so far this year. Most of them are from July and August. And to put it in perspective, all of last year, there was just a hair over 10,000 cases. And since dengue has first been recognized in Bangladesh back in 2000, the number of cases just seen during the first 20 or so days of August is more than almost 2 decades worth of dengue cases in Bangladesh. So yeah, it's a big, big problem. I think there's been about 35,000 dengue cases in the first 20 odd days of August in Bangladesh. Now the fatality rate has been 47 officially from Bangladesh health officials. However, if you look around online and look at Bangladesh news media, most of them media accounts are putting the death toll at least double that, close to 100 or more. So we'll see how this works out when it's all over. And they're expecting this outbreak to go on for maybe through September and October, which would be devastating. But it's still going on. So yeah, so that's our coverage of the big story in Asia. And of course, it gets political too. There's a group of environmental activists that came out yesterday criticizing the government's failure to contain dengue. And it urged the government to involve people from all walks of life to tackle the dengue outbreak across the country. And it says, speaking at a rally organized by Bangladesh Parabesh Andalan in front of the National Museum in Shahbag, they termed the activities of authorities concerned in this regard as, quote, ineffective and eyewash, close quote. And they go on to say that the government is yet to take an all-out effort to tackle the dengue outbreak. We demand that all government and non-government institutions across the country are engaged in this regard, said Dr. Abdul Matin, the General Secretary of BAPA, the Bangladesh Parabesh Andalan. And they go on to say that the government is not announcing the situation as an epidemic in fear of hurting its image. So yeah, so second continent we've gone over, the second time elections and politics are a main issue with the outbreak. Very, very unfortunate. Okay, next continent, Australia, Oceania, and I'm going to specifically talk about the measles outbreak in Auckland, New Zealand. And you can see from this map here in the upper left-hand corner, there's been 616 measles cases in Auckland, the Auckland area. And if you look in the bottom right-hand corner, last Sunday, there was 478. So just this one portion of New Zealand has seen about 150 measles cases over the course of a week. And in this article from Stuff, New Zealand, it says this year's spate of cases marks the 4th outbreak in a decade. So the first outbreak in 2009 had 248 cases. There we go, right here in that bar chart. 596 in 2011, which was the highest in the past decade until now. 2014 was the third outbreak, and that had about 280 cases. And through August 19, almost a week ago, there was 639 cases in New Zealand altogether. Of course, that number is higher than that now. So the whole country is experiencing a measles outbreak, but Auckland is being hit extra hard. So we'll be keeping an eye out on that. I've been covering it periodically on the website outbreaknewstoday.com, and it's just a rising number. And that brings me to I'm in the U.S., so that brings me to a more local story, and it just came out today that in the Los Angeles, Southern California area, there was a teen from New Zealand who came to this country with measles. And it says they may have exposed hundreds at Disneyland and other tourist destinations. So a teenage girl traveling through Southern California may have exposed hundreds of people to measles. She spent time at various Southern California attractions, including Disneyland, Universal Studios, Madame Tussauds in Hollywood, and several other ones. So right now, that's the concern in the Southern California area, is this potential exposure to a lot of people due to this young girl from New Zealand. It doesn't specify whether she was from Auckland or not, but like I said, the whole country of New Zealand is experiencing a lot of measles this year. Okay, next up is Europe. And the outbreak, infectious disease news story I wanted to cover this episode is the listeriosis outbreak in Spain, the largest one they've ever had. And this is from the Spanish Ministry of Health. It's in Spanish, but I used that to write a story on outbreaknewstoday.com, so I got it translated, and let's go over that a little bit. The official Ministry of Health numbers put the case tally at 175 through last Thursday. So this outbreak started about 2 to 3 weeks ago. The bulk of the cases have been reported from Andalusia. That's 161 cases. Then there was a smattering of other cases in Madrid, Aragon, Catalonia, and some other areas. The outbreak has been linked to the consumption of roasted pork meat produced by a company in Sevilla, Spain. And they identified it as meatloaf, marked La Mecha. Hopefully I said that right. And it was made by a company in Spain itself. So that's been recalled, and authorities have basically suspended business there at that plant, and they're doing all the necessary recalls and withdrawals from the customer, make sure that they can get this outbreak under control. Now, the official numbers from Spanish Ministry of Health was 1 fatality. However, according to this Washington Post report, a second fatality was reported, and this just came out Friday. Spanish authorities say a second person has died in an outbreak of Listeria from pork meat. The health spokesman for the southern Andalusia region, Jose Miguel Cisneros, said Friday a 72-year-old man who was in a terminal phase of pancreatic cancer died from the bacteria. And the first fatality, of course, was that 90-year-old woman about a week ago. So, next up, North America, right? So I could choose from Canada, the United States, or Mexico. And what I'm going to look at is this story about valley fever in this country. And I got this email earlier this week of 2 U.S. representatives from Arizona, David Schweikert and Greg Stanton. And they got together and with medical experts and patients that have been diagnosed with valley fever, and they had a sit-down dialogue about the fungal infection and finding a cure. A big problem in Arizona and California, for that matter. So, and this follows a bill that they introduced back in May, and it's called HR 2858, Finding Orphan Disease Remedies with Antifungal Research and Development, or the FORWARD Act. This legislation would address the short-term, medium-term, and long-term challenges to detecting, treating, and eventually eradicating valley fever. Now, quote, every year, our community sees an increased rates of valley fever. This legislation pushes for a breakthrough in research. It also introduces the first blockchain pilot program for collecting data for fungal diseases. As scientists are getting closer to a cure for valley fever, soon a vaccination for our pets, I look forward to seeing how the critical resources provided in this legislation will positively impact the Southwest. We are extremely hopeful that a cure is in our near future, says Representative Schweikert. Senator Martha McSally said, valley fever poses a critical health risk in Arizona, with nearly 2/3 of all cases nationwide occurring in our state. The Forward Act aids in research, treatment, and most importantly, prevention of valley fever to deliver assistance to our communities in need. We need to take this seriously and ensure that resources are invested in the fight against this disease. So, how bad is it? Well, it's interesting that they talked about this this week, because about 2 or 3 weeks ago, I did do a story on the number of valley fever cases in the United States through July. And of course, valley fever, also known as coccidioidomycosis, it's a fungal infection. It's found in the soil, and it's common in southwestern United States. And I looked at CDC data, and through July 27th, there was 9,735 cases reported for that 7 months. Slightly higher than the 9,200 cases reported the same period last year. Now, 98% of all cases have been reported in 2 states, Arizona and California. Arizona and California have seen 5,543 and 4,013 cases respectively. When you go into Arizona, Maricopa County has seen by far the most, with almost 4,000 cases alone, and I believe that's the Phoenix area. And in California, 1,500 cases have been reported in Kern County. So, yeah, that was kind of I thought, some of the bigger news concerning outbreaks in the United States, in North America, during the past week. And let me go ahead and close it out with South America. And the Pan American Health Organization put out this report warning of the complex situation of dengue in Latin America and the Caribbean. It says the PAHO warns of the complex situation of dengue in Latin America and the Caribbean, a region that is currently experiencing a new epidemic cycle of the disease after 2 years of low incidence. According to the latest epidemiological update published on August 9th, during the first 7 months of 2019, more than 2 million people contracted the disease and 723 died. The number of cases exceeds the total number of cases reported in 2017 and 2018, although so far it still remains lower than the number recorded in 2015 to 2016, which both had well over 2 million cases. Now, the region is experiencing a new epidemic cycle of dengue with a notable increase in cases, said Dr. Marcos Espinal, director of PAHO's Department of Communicable Diseases and Environmental Determinants of Health. The climate, environmental management, and the mosquitoes' capacity to adapt may have caused the situation to increase in complexity. Another characteristic of the current epidemic is that children under the age of 15 appear to be among the most affected. In Guatemala, for example, they represent 52% of total cases of severe dengue, while in Honduras, they constitute 66% of all confirmed deaths. According to Dr. Espinal, this may be due to the fact that their age means that they have been less exposed to the virus in the past and may therefore lack immunity. So yeah, so that big outbreak going on in Central and South America of dengue fever, well over 2 million cases to date. All right, well that's the inaugural episode of Outbreak News Across the Globe. I hope you enjoyed it. If you have any stories you'd like to share, go ahead and shoot them to me. Leave it a comment down below, and I'd love to cover that story in a little bit more detail on the program. So go ahead and subscribe, share with your friends, and I'll see you next time.